Your service dog can smell changes in your body reflective of a change to a disease state before any symptoms appear. Here's how. I'm Dr. Raj. I'm a medical doctor and co-owner of Summerfield Service Dogs. And dogs really can smell changes to our body. And those changes can reflect things like infection, changes to chronic disease states like diabetes or seizures. And those changes can be detected by a dog. Canine olfaction is as everyone knows, a really strong sense of smell that dogs have. And dogs can actually detect changes to chemicals that come from our bodies. And those changes can suggest to dogs that there's something going on. So can dogs really detect changes to our body through smell? Yeah, they can. In fact, some studies show that dogs can detect changes to our emotional state. We're talking about happiness or stress. There have been studies that show that there's likely that volatile organic compounds, or VOC, play a role in this mechanism. VOCs are like a chemical mediator or signal that our bodies make, and they are reflective of our physiology or our internal state. So these are actually influenced by things like infection, certain disease states, like changes to our chronic diseases that we may have, as well as disease-causing pathogens. And as those change, dogs are able to pick up on that and respond to that. One interesting application of service dogs and their ability to smell a change in a patient's odor that reflects some kind of disease state is epileptic seizures. Seizures is a neurological disorder, and it typically can involve a range of symptoms. On one end, patients can have repetitive motion in their upper and lower extremities while they're unconscious, and that can lead to situations where the patient can injure themselves. They can bite their tongue, they can injure their body, they can also injure their brain in some situations, depending on the length of the seizure. And seizures, on the other hand, can be much more subtle. The patient can look like they're just spaced out or not paying attention to what's going on in the moment and just maybe smacking their lips, so to speak, that a very subtle repetitive motion. And I discussed already, seizures are tricky because they can result in injury to the patient. And that's one role that service dogs play, is to alert a patient to an upcoming seizure and also to respond to a patient's seizure. In some cases, a service dog may position their body to try and protect the patient, or in other cases, they may try to move the owner or handler before the seizure occurs to try and minimize injury to them. One study looked at 5 service dogs, and they paired them with 5 patients, and each patient gave a sample in basically 3 different scenarios. One was when they were having an epileptic seizure, and that was a sample. They were all samples of their breath and sweat. And one other sample was when they were not having any kind of seizure and they were just doing a calm activity. And the third sample was when they were doing some kind of vigorous exercise. And that was just to try and account for, is sweat simply the thing that the service dog is cueing to, or they're identifying as the problem. So they took those samples from those patients and they exposed each of the 5 service dogs. And mind you, none of these service dogs, while they were trained, they had not trained with these patients at all. They were completely new to the patients. And they found that the service dogs were pretty accurately able to identify the samples from when the patient was having a seizure. The sensitivity ranged from 67% to 100%, and the specificity ranged from 95% to 100%. So that high specificity means that they were pretty accurate with it. The sensitivity ranged a little bit more, from 2/3 to 100%, and that suggests that they caught most of those cases. I'll also add that not only was the sensitivity and specificity high in these cases, but also the dogs took a very small amount of time to make a decision. and that time was about 1 to 5 seconds. So they moved very quickly, and they were pretty accurate too. Another application of canine olfaction, or the dog's sense of smell, is to help patients with diabetes. Now, diabetes is a disease where patients can develop either insulin resistance, where they're not as sensitive to insulin, or they don't make insulin at all in the case of type 1 diabetes. And in those situations, they can be subject to high levels of blood glucose or low levels of blood glucose, which people often refer to as blood sugars. And there was another study that looked at 27 dogs and 4,000 recorded levels of low or high blood sugars or out of range blood glucoses. And in this study, they looked at the sensitivity that the dogs had in detecting these out of range episodes. And in this study, they found that for out of range episodes, the dogs had a 70% sensitivity. When they looked at low blood glucoses only, or hypoglycemia, that sensitivity came up to 83%. And when they looked at high glucoses, that sensitivity was in the upper 60%, 67. So even at that 67%, we're talking about nearly 7 out of 10 times the dogs were able to identify an out of range glucose. All right, so we talked about volatile organic compounds and their potential implication as an underlying mechanism as to how dogs, and specifically service dogs, can detect changes to the chronic diseases that their patients or their handlers have. We talked about some specific types of diseases that applies to, specifically diabetes and seizure. I hope this was helpful for you. Again, I'm Dr. Raj. I'm a medical doctor and co-owner of Summerfield Service Dogs. If you're interested in a service dog, give me a call or send me an email. I'd be happy to talk with you further about that today.